Hello, my name is Dr. Kimberly Wintemute. I'm a family doctor and an assistant professor at the University of Toronto in Canada. I was recently able to attend the 14th Annual Congress of the Brazilian Society of Family and Community Medicine in Curitiba. During the Congress, we engaged in some meaningful discussion about prostate cancer screening because in both Canada and Brazil, November is Prostate Cancer Awareness Month. Let's consider some of the potential harms of prostate cancer screening. These are important things to think about in making a decision whether to be screened for prostate cancer. In discussing harms, we're doing so because we know that an individual must weigh the risks and the benefits of any screening test before deciding whether to be screened or not. To understand prostate cancer, first of all, we need to know that 2/3 of prostate cancers are so-called low-grade cancers. These don't really behave in the way that we usually think about cancer. These cancers don't leave the prostate gland, and they don't generally threaten a person's life. 1/3 of prostate cancers, however, do behave like cancer and can threaten a person's life. If 100 men are screened for prostate cancer and they have a positive screen, that is, they have a concerning PSA value, we know that only 30 of those men will actually have prostate cancer. This is because the PSA test can be elevated by other things, such as infection or inflammation. On the other hand, if 100 men screen negative with the PSA test, that is, they have an apparently normal PSA test, 17 of those men will in fact have prostate cancer. That is, the test also has a false negative rate, and this is important to understand. Now, most men who have a positive PSA test will go on to have a prostate biopsy. We know that 17 of those men will have serious complications, the most common one being an infection in the prostate gland that can leave the prostate and go through the bloodstream, causing that person to need to be hospitalized and have intravenous antibiotics. Most other men will also have some short-term pain or blood in the urine from their biopsy. Let's also consider the risks or potential harms of prostate cancer treatment. If 100 men are treated for prostate cancer with either radiation or surgery, 30 of those men will go on to have long-term sexual dysfunction. And that is a problem that cannot be looked after by modern-day medications. Another 20 men out of 100 who are treated for prostate cancer will have ongoing problems controlling their urine. And another 20 men will have short-term complications such as infection, additional surgery, or blood transfusion. So it's very important to have a rich conversation with your family doctor about whether or not to be screened for prostate cancer. Only you can decide whether to have a PSA test, because weighing the risks and the benefits of any screening test is really based on your own individual values. Thank you very much for including me in this dialogue about prostate cancer screening.